Hi, everybody, and thank you for joining. We will be starting in 2 more minutes. We're just going to give some time for latecomers. Okay, thank you everyone for coming and welcome to our webinar. My name is Aliyah. I'm a medical licensing advisor at the International Medical Aliyah program, and we're very excited to see you all here today. I would like to begin with introducing my colleague Rachel from Misrad HaKlita, the Physicians Olim Directorate, to say a few words, and then we will continue. Rachel, you're on mute.
Good afternoon, everyone. I'm very happy to meet you all. The Directory of the Doctors is actually originated from a decision of the Israeli government to strengthen the Israeli health system with the support of Nefesh B'Nefesh and the Ministry of Health. And we focused on physicians, nurses, and pharmacists. We give support before Aliyah and after Aliyah. Actually, people coming from South Africa are able to, while they are doing, they are submitting all the papers for the licensing and recognition of their specialization with Aliyah, they can also start look for potential places for work when when this process is complete, even before Aliyah. And this is something that is a possibility only for English-speaking countries. So my role in the directorate is to help you with employment and planning your employment process in Israel. We also give you a lot of additional tools. The most important one is learning Hebrew. This is critical if you want to work in the Israeli medical system that operates in Hebrew. So it's really, really important to start learning Hebrew before making Aliyah. And of course, after you make Aliyah, as doctors, you have benefits. We support employers and help you find a place to work. And we support employers who hire you. So at least at the beginning, we help you to integrate professionally. And I am sure that later on, everyone can get along. But you stay an Ole and receive the support of the Ministry of Absorption 10 years after making Aliyah. So you can also return to us if something is not okay. you have somebody who will help you and support you. Thank you.
And again, welcome everyone who is joining us as a follow-up from the seminar that you have recently been to, and those who are just starting to explore the process. As I said before, my name is Aliyah, and I'm a medical licensing advisor at Nefesh B'Nefesh International Medical Aliyah program in partnership with Misad HaKlita and Misad HaBriut. I would just like to remind everyone that this webinar will be recorded, so the link to the recording will be sent out afterwards, so no worries, don't have to write everything down. This will be available to you again. I will also say that throughout the whole webinar, we have Allison here, you can see keeps popping up, saying that you can write your questions in the Q&A section. Please do not write them in the chat. Write them in the Q&A, and one of our colleagues will try and answer them throughout the webinar. If by the end of the webinar you feel like your questions have not been answered, or you need a little more case-specific information, just reach out to us via email, and we'd love to help you throughout the whole process. Also, all the links that I will be discussing in throughout this webinar will all be sent in a follow-up email together with the link to the recording of the webinar. I'm just going to share my screen quickly. Okay. So what is this webinar going to be covering? We will be discussing how to obtain an Israeli medical license, transferring specialist credentials. We'll be touching on employment with the help of Rachel. We won't be discussing Aliyah primarily. Aliyah is more speaking with the Jewish agencies, Global Aliyah Center, and Telfed. And I will be speaking mainly about the medical licensing process. Again, I'll just remind you, all your questions, please put in the Q&A box, and we will answer them throughout the presentation. So, how would you get a medical license in Israel? Licensing as a physician in Israel is a two-step process, and this can begin before you make Aliyah. Very, very important thing to keep in mind. You can start this before you make Aliyah, and you can complete 99% of the process before you make Aliyah. So what are the two steps? Step number one is to apply for an Israeli medical license from the Ministry of Health. Step number two is to apply for recognition of specialization through the IMA, the Israeli Medical Association. Now, throughout this presentation, I'll be diving into each one of these steps, and also speaking about people who don't necessarily want to have their specialty recognized. So let's begin with the application for the Ministry of Health to get your Israeli medical license. The application should be sent directly to the Division of Medical Professions Licensing Office. This can be done either by registered mail or by dropping off during regular business hours. What is this application? The application is basically your set of documents that you will be submitting to the Ministry of Health, which I will get into in the next slide. The review of the process, once you've submitted all your documents, can take up to 3 months. I will say that they've been quite good lately and quite quick, so it may take less, but 3 months is the timeline that we give, that date that they say and that they try to commit to. So that's another thing to take into consideration when planning your Aliyah process. Now, once you submit your documents and receive your file is reviewed, hopefully you should be getting approval pending Aliyah. Now, I'm stressing pending Aliyah because you will not get your Israeli license until you actually make Aliyah. Once you make Aliyah, all that is left to do, if hopefully you've been approved pending Aliyah, all that is left to do is to submit a copy of your Teudat Zehut. Also can be easily done. You send a picture of it to us via email, and we will forward it to the Ministry of Health, thus hopefully completing your file. And within a few days, you should be getting your Israeli medical license. So that, in a nutshell, is a process for your license, for your Israeli medical license. Now, the documents that you would need to submit to the Ministry of Health: 2 passport photos, 2 photocopies of your passport. If you have an Israeli passport, that's what you should be submitting. If you don't have, no worries, submit the one that you do have. Questionnaire for healthcare professionals is a questionnaire that you would need to be filling out, basically covering your personal details, name, transliteration of your Hebrew name, your employment history, your study history. So that's something that you need to fill out. Don't worry, a link will be sent out after this webinar. Diploma and valid South African license, you'll see next to the in the list, it says verified copy. I will be going into what this actually means in my next slide, but just remember, these are the documents that need verification. This is your diploma, your MD diploma, and a valid South African license. Board certification, for those of you that it's relevant for, the board certification, all you need is a photocopy of it to be added to the rest of your documents. And a certificate of status, also known as a letter of good standing, which would need to be sent directly from the issuing body to the Ministry of Health, either by mail or by email, both of which we will be sending the address and the email address we will be sending to you in the follow-up email. The other option of submitting the letter of good standing is having it sent to you from the issuing body, but then you would have to make sure not to break the seal on the original envelope, add it to the rest of your documents, and send it to the Ministry of Health. Okay, so that's the list of documents. Again, no need to memorize this. This can all be found also on our website and also in the links that will be sent out afterwards. So returning to the diploma and license, for those of you who remember, those are the 2 documents that you need to have verified for the Ministry of Health. You have a few options of verification. Option number 1 is going to any licensed Israeli notary. I know this is something that can be hard to come by in South Africa. If you happen to know an Israeli notary in South Africa, you can use his services. If you happen to come to Israel for a visit, you can bring your documents with you and have them notarized. But that is option number 1, having it notarized by an Israeli notary. Second option is to go to the local Israeli consulate or embassy and get an imut ha'etek for your documents. And your third option is to have it notarized by a local notary public in South Africa, and then an apostille. So this is for your diploma and license. Now, just a few more important points. No matter what it says on the Ministry of Health website or on the IMA website, anything originally in English does not need to be translated, okay? Misrad HaKlita may reimburse you for notarization costs for up to 4,000 shekel, but please note that this is only relevant if you use a licensed Israeli notary or if you get an imut ha'etek from the Israeli consulate or embassy. This does not apply to an apostille. Once you make Aliyah, if you make Aliyah within 2 years of receiving the receipt from the notary, you'll be able to go to Misrad HaKlita and submit it, and hopefully you'll be able to get reimbursed. What do you actually send to the Ministry of Health from the verified documents? Please do not send in your original documents. Do not send in your original diploma. Do not send in your original license. You would need to send in the original authenticated copy of your license, the one with the actual red tape. That's what you should be sending into the Ministry of Health. My personal recommendation, make yourself a copy just for future reference of these notarized documents, but please don't send in your original documents, just the original authenticated copy. That is the Ministry of Health licensing. So quick recap, 3 months, once you submit all your documents, the list of documents that have been sent, you would have to have your diploma and license verified, send them all in together, try and send in all the documents as much as you can together, just so that things don't get lost. And then within 3 months, hopefully, you will get approval pending Aliyah. Once you make Aliyah, you submit your Teudat Zehut and you get your Israeli medical license. And now I'm throwing you back to our 2 stages of getting your Israeli medical license, of what it means to become a specialist here in Israel. And step number 2, as you may recall, is getting your specialty recognized by the IMA. Now, we are aware that in South Africa, there are specialist GPs who may have not done a residency. So one thing that you need to know is that IMA requires completion of a residency for specialty recognition. For those of you who are still at the beginning of your professional life, and this seems to be something that can be relevant to you, you can consider applying for a residency program in Israel. This is something that you can consider doing. Applying for residency in Israel is like applying for a job. You basically approach hospitals and medical institutions and see where there is a vacancy. For those of you who are interested, on the IMA website, you can also find a list of the places that you can do a residency in. And here's a good moment to remind you of the Physicians Olim Directorate, who can help you with this, help you with residency, with employment placements. But here we're speaking about residency. So definitely reach out to them if this is something relevant to you, or reach out to us and we will refer you to them. But definitely, if you are a junior doctor, it's just at the beginning of the road, or this is something that is interesting for you, that is something that you can also do. I will say that there are alternatives for specialists who do not want to get their specialty recognized, or who have not done a residency in South Africa. Again, this is a great thing to speak about with the Physicians Olim Directorate, but I'm going to quickly touch upon it. You can work in private practice, advertising yourself as an Israeli licensed physician, South African specialist. You can work in places like Terem or Briuta, which are urgent care facilities, who will take on physicians who haven't had their specialty recognized, working a second job in telehealth as a specialist consultant. So there are options. This is something important for you to realize. There are options, even though you can't get your specialty recognized in Israel because you haven't done a residency, there are different options. Now, to those of you who haven't yet completed a residency, you're either just out of med school or have started some of your residency and are planning on making Aliyah in the middle, also for you, there are different options. So if you're fully graduated from med school and you hold a South African MD diploma, they have not done your internship year or 1 year of residency, there is an option of doing stage in Israel. Now, how does stage in Israel work? You basically enter a lottery that decides on where your placement will be for the year of stage. But an important thing to know is, in order to enter this lottery, you have had to make Aliyah. If this is relevant for you, please just email us and we will guide you through this process. I'm not going to go into more detail now, but again, if this is relevant to you, just email us. If you have done at least 1 year of internship or residency training, you would need to submit the official documentation detailing this, both for the Ministry of Health so that you can get your license in Israel, and also for the IMA, because some of this time may be recognized towards residency in Israel. Again, if this is relevant to you, please just email us and we'll guide you through the process. So as I said, based on the documents that you send into the IMA will issue a decision letter regarding additional residency requirements. So now we've touched upon people who haven't done a residency in South Africa. We've touched upon people who have done a partial residency, and now I want to speak to the people who have done a full residency and want to have their specialty recognized in Israel. I'm going to do a quick run through of the process of the IMA, and then we're going to dive into each step. So again, if you have any questions, use the Q&A box and Allison will be answering. And if you don't feel like your questions have been answered, email us at the end. First thing, like the Ministry of Health, first thing to do is submit your documents. But unlike the Ministry of Health, the documents this time are to be submitted to an online portal, which means no need to post any documents. You take a clear picture of the documents, you upload them to the portal. Again, the link for the portal will be sent out in the follow-up email. You put in your details, and then they start evaluating your file. Now, I will say that the IMA takes longer than the Ministry of Health. We have no specific timeline. This can take anywhere between 6 to 8 months. It can take less, it can take more. This is something that I cannot guarantee for you, and neither can the IMA how long this will take. This is why we recommend physicians begin the process about 1.5 to 2 years before making Aliyah, because this process does take some time. Once submitting your documents, you should get a decision letter from the IMA. Now, before I actually speak about what's in the decision letter, an important thing for you to know when planning out your Aliyah is that the decision letter is good for 5 years. So that gives you a little bit of breathing room to plan out the process. Now, what would say in the decision letter? So the decision letter from the IMA can say various things, but mostly for physicians who come from countries like South Africa, it will usually be requesting a hatama. Hatama, you may have heard of the word before, formerly known as histaklut. This is basically an observation period. This is not an internship. This is not a residency. It's an observation period where you work as a physician in your specialty in one of the hospitals or medical centers in Israel, at the end of which your supervisor will be submitting a letter to the IMA with a recommendation, and then you should be getting, hopefully, you should be getting your specialty recognition. Again, I will remind you for help finding placement for Atama, please speak to the Physicians Olim Directorate. And now that we've done a brief run through, I'm going to dive into each thing. Okay, so the documents for the IMA, we're not going to go through the list because the list is longer. It can be found on our website. If you have any questions, please just email us. One of the things that you'll be getting in our follow-up email is the link for the IMA portal. Once you press on the link, you will get to a landing page. If you are new to this landing page, the first thing you do is press new users and a new request. Now, once you've started submitting your documents, I would suggest in the first run to complete all the way down to contact details. As you can see here on the left, there's introduction, personal details, contact details. I would suggest completing all the way down to there. And then if you feel the need to go out and restart and take a break and find more documents and so on, you can always come in and out and save the progress, but please finish up to contact details. At that point, you should be getting an email from the IMA with an ID for your portal. And then if you want to come back again, you'll be, instead of pressing new users, you'll press registered users, and you'll be going into my request. We can send to those interested, we can send in a full explanation of the IMA portal in an email, and it can also be found on our website. So this is what the IMA portal will look like, and at the end of it, they'll be asking for your residency track and internship track and employment. So this is something that I would suggest take very, very seriously and sit down and have and fill it out as to the best of your ability. As I said, the next stage is hatama. What is hatama? How long is hatama? Hatama is usually a period of 3 to 6 months where you work under observation, like I said before. An important thing to know about hatama is throughout this time, your salary is paid for by Misrad HaKlita, is funded for by Misrad HaKlita. It's somewhere between 5,600 to 5,800 shekel a month, which we know is low salary, but please keep in mind that a few things. First of all, it is for a limited amount of time. Second of all, this is a great onboarding experience for you to improve your Hebrew and to learn the system and the team and the patients. So it's really a great onboarding experience. And another thing to keep in mind is that we know of many Olim physicians who have used this as a negotiation point if they decide to work where they originally did the hatama. Again, this is a great thing to discuss with the Physicians Olim Directorate who can help guide you through this whole process. For those of you who do not want to complete specialty recognition, I'll just remind you that there are other options like private practice, Terem Briuta, the urgent care facilities. Again, a great thing to speak about with the Physicians Olim Directorate. For those of you who this is relevant for, Army service. I don't know if you've heard or haven't heard, but physicians have a higher drafting age. You can see it here. It changes for men, for women, depending on how old you are, marital status. I'm not going to go through this. And again, you do not have to remember anything. This is all on our website. First of all, if this is relevant for you, reach out to us. We can help you whether you really, really want to go into the Army or whether you really, really don't want to go into the Army. I will say unofficially that we have heard from the Army that they do not tend to drag physicians kicking and screaming to be drafted. So again, reach out to us if you're in the relevant age and if this is something that concerns you. During the Army, most physicians will serve as GPs unless there's some special circumstances with their specialty. This is also a great onboarding experience. It's a good salary, it's a good onboarding experience. Again, reach out to us if this is an option for you, if you're particularly motivated. Be in touch with us individually. We're coming to the end of our presentation about the licensing process, so I just want to give you a few tips and tricks from us at IMAP. Again, 99% of the process can be completed before Aliyah, so take advantage of that. We are here to help you through it from the beginning till the end of it, and you can come to Israel ready with an approval for your license. So try and take advantage of that. Try and put that into your planning, into your Aliyah planning. Some of you may have heard or may have had a permanent license or a temporary license. I will say that what I have been talking about is for a permanent license. Once you receive your Israeli medical license, there is no need to renew it, nor your specialty recognition. Okay, but some of you, excuse me, may have applied or received a temporary license, either during the war, before the war, volunteers, and so on. Please know that for the temporary license, you have to resubmit all your documents. They would require more than just scanned documents, which is what you had submitted. You would need to submit everything from the beginning. Some of you may have heard of a limited permit. A limited permit is something that's good for someone who's checking out what it's like to live in Israel, not 100% certain. Something to know is that this is not for an Israeli citizen. You would have to come on a visa. You could have to come on a work visa. And as its name, it's limited. It's limited to a specific hospital, a specific department for a specific amount of time. And it requires the same set of documents for a permanent license. So that's just something to keep in mind. Again, reach out to us if this is relevant to you. As I said before, please send in all your documents together as much as you can. We just don't want anything getting lost. So try and do it all together. We are here to guide you every step of the way. As you see, there are really no silly questions. Everything's on a case-by-case basis and things can change between each person. So please feel free to contact us at medpro@nbn.org.il. I'm now gonna give the mic back to Allison for any questions.
Hi, thank you so much, Elior, and thank you again, Rachel. This was a great overview. I've been answering a whole bunch of questions in the QA regarding Hatama, so I wanted to just go back to a few points that were raised. First of all, as Elior said, the technical salary is pretty low for the Hatama, but we've seen in so many cases where people can get more than the mandatory minimum, whether it's through negotiation with the help of Rachel, whether it's because you're going to continue working in that same medical institution or just for other reasons. So I wouldn't be too afraid of that as a barrier in terms of salary. Let's continue that conversation, either our staff or directly with Rachel if you're taking steps to move forward. The Hatama is just for those who are doing specialty recognition, meaning if you did not do a residency, you're not a specialist, you're just applying for the Israeli medical license, you will not have to do a Hatama. It is something that has to be done in a hospital or Kupat Cholim, depending on your specialty. For example, family practice can often be done in a Kupat Cholim, which is a community clinic. I'd say most of the time the Hatama is done in a hospital setting. So even if you're planning on only working privately in the future, maybe you're a dermatologist, for the Hatama, you're going to have to do that period in the hospital. I think that covers most of the questions that came up regarding Hatama. A lot of questions often come up regarding Hebrew. I'll say a word about that, and then I'd love to throw the floor back to Rachel to talk about what Misrad HaKlita is doing these days in terms of helping physician Olim work on Hebrew. We get questions all the time about how much Hebrew do we need? How do we work on our Hebrew? I'd encourage you, if you're thinking of Aliyah, even if you're not in active planning mode for Aliyah, already now, start to work on your Hebrew as much as you can. Start to think about ways that you can in your spare time work on Hebrew, whether it's an app on your phone or a course in the community, whether it's an online program, whether it's YouTube videos, where it's a pre-Aliyah Ulpan. There are many options out there. But before you even get to that, I'd encourage you to take a step back and think about how much English do you use in your professional practice? If you're an anesthesiologist, you probably use a much smaller vocabulary in English than you would if you're a psychiatrist. Start to think about how much English do you use in your day-to-day work, and you'll have a better idea of your medical Hebrew goal as a professional working in Hebrew, working in Israel. Rachel, would you like to speak a few minutes about Misrad HaKlita's initiatives for medical ulpan for doctors? And Rachel, you're just on mute. If you can take yourself.
I know.
Go ahead.
I muted myself. So first of all, I'm very happy. I see that Ziva is here with us. So Ziva, this will be for you. I hope you will not be angry with me. Hebrew is critical. Israeli patients are Israelis, and Israelis, their mother tongue is Hebrew. So although professionally you can get along with other colleagues in English, most doctors in Israel do speak fluent English anyway. To be able to work, you must have a high level of Hebrew, and I 100% agree with Alison. Your specialty makes a difference. For example, dermatologist just look at the skin of the patient. He doesn't need a lot of communication. He does need to communicate, but not as much as a family doctor or a pediatrician, where the clients also don't speak at all with pediatricians. So it's really, really important. I know that the Jewish Agency and Misrad HaKlita have a lot of new initiatives about learning Hebrew before making Aliyah. The thought that you can come to Israel without Hebrew and just go to 6 months ulpan and reach the level of Hebrew that employers require, it's just not realistic. So what you can do, I strongly advise you to start to find environments which will enable you to communicate and to speak Hebrew, any Hebrew that you have. And this is why I said Ziva, and I would like to add Daffy, who is not here. They are both Israelis. They are both in Johannesburg. And why don't you volunteer at the Israel Center and be able to speak and communicate, speak with them? So that's something that if you even come once a week for a few hours, 1 or 2 hours, just utilize whatever Hebrew you have, start improving your Hebrew. I know Ofek Israelis also have initiatives about online Hebrew courses. Really, it's really, really important to really reach out for your local Sochnut. Actually, they know the best, and they are updated about any initiative related to learning Hebrew, and really reach out for them, and I'm sure you will have solutions.
Okay, great. Thank you, Rachel. Hebrew, Hebrew, Hebrew. Even if you're going to be living in an English-speaking neighborhood where you've heard you can speak to all your clients in English, it's limiting. It's true that there are positions where all of your clients are English speakers and you can really get by in English. That part is true, but without working on Hebrew, without being able to work in Hebrew, you're going to have much more limited options. And especially if you're going to be in a hospital setting or community clinic, you'll need to be able to communicate with the other staff on your team, in your department, etc. Elior mentions that it's really important to start this process early. I just want to go back to that. Elior recommended starting this whole process about a year and a half to 2 years in advance. And we really, really do encourage you to do that. However, let's say right now your plans have changed and you thought you were going to be making Aliyah further down the road, and your timeline has shifted and you want to be making Aliyah this summer. It is doable. This can happen. Don't get discouraged because you didn't start the process in advance. Some people don't even start any of this licensing or specialty recognition until they've arrived in Israel. There's nothing that says that you have to do it pre-Aliyah or you have to do it by a certain time, especially for those who want to have all their ducks in a row, especially for those who want to be able to hit the ground running and work as soon as possible and have their license in hand as soon as possible. We do encourage you to start earlier. Just to recap, the Ministry of Health, which is your basic Israeli medical license to practice, should not take a long time. It's pretty binary. You have a medical diploma or you don't. You have a valid license to practice or not. And you're basically proving that with your documentation. And really, they have, as Elior said, up to 3 months to process that. We see that happen usually much faster than that. And you should be approved pending your Aliyah. If you need specialty recognized, that takes longer. However, be in touch with us. Let's say you're just putting in your documentation now, but you're making Aliyah this summer. That's something that we can help you try to make sure that your file is expedited. We can be in touch with the IMA after you submit your documents and say, listen, this doctor is making Aliyah in May, and we would like to make sure that the file gets reviewed as soon as possible. Elior took a little bit of time to go through the portal. I will add a note in parentheses that the IMA portal is relatively new. Sometimes it gets a little bit glitchy. Sometimes it's a little bit difficult to understand exactly what needs to be uploaded. Our staff has been trained on the IMA portal at the IMA. We work in constant communication with them. And if you are looking to start an application to the IMA and you feel that the portal is a little bit overwhelming, you're getting stuck uploading your documents, reach out to us. Our staff are available to you from the moment you're even thinking of Aliyah and talking about your plans as a doctor in Israel, up until when you are really moving forward and working on the processing, the licensing, the application for your specialty recognition. Meaning Elior or Joey or somebody else from our staff will be happy to sit on Zoom with you, go through all the uploading, go through the portal together. We are here to help you every step of the way. There's a question about whether it's possible to do an online medical Hebrew Ulpan from outside of Israel, meaning before you've made Aliyah, are there online medical Hebrew Ulpans available? Rachel, do you want to speak about some initiatives that the Misrad HaKlita has been doing for doctors before they've made Aliyah?
So there is a Hebrew Byte that you can see on our website. As I mentioned before, there are collaborations with other organizations. For example, the World Jewish Organization have online Hebrew studies. And as I said, Ofik Israeli is having initiatives. There are several initiatives. Also, I do advise to check local opportunities in South Africa too.
Perfect. I just want to echo that by saying, please use all of the resources available to you, whether it's in your local community through the options offered by Misrad HaKlita, depending on where you are in the process. And I'll also add that some Olim have found private options useful as well. Whether it's taking a private tutor to say, this is the set of vocabulary I need to work on so that I can be ready to work in Israel, or there are sometimes private medical ulpans available online as well through private companies. You should know that you have free benefits through Misrad Klita, but that doesn't mean that there aren't other resources out there. A question, do we only cater to doctors or other medical related professions? I'd encourage you, if you're not a doctor, to reach out to the Jewish agency. They really do have the resources to help you if you're not a doctor. Our program, the International Medical Aliyah program, the mandate is from Misrad Klita, the Ministry of Health, and the Jewish Agency to focus on doctors. So that's the topic for today, and in general, what our focus is on. All right, other questions? Thank you very much for everybody who's participated today. I just want to wait another minute to see if there are any questions left. I will make sure that you have the contact information for IMAP for our department to reach out to have follow-up conversations with Elior or the rest of our staff. There's also the Israel Center, and I'll make sure that their contact information is in the follow-up email as well, to talk to them about your Aliyah processing, other Ulpan going on in your community, and to continue the conversation with them, as well as the contact information for Rachel and the rest of the Physicians Olim Directorate at Misrad Klita. Rachel, Elior, thank you so much for an excellent presentation. Thank you to everybody who joined us today. We look forward to continuing the conversation with each and every one of you and helping you achieve your dreams in Israel.
Yeah,
Thank you.
I'll be happy if you contact the Minhelet, and usually I do one-on-one meetings with upcoming doctors. So please contact me through the mail and we will schedule a personal meeting with each one of
Wonderful. Thank you very much. Have a good day, everybody.
you.